I would first like to introduce you to the love of my life. This is my 13-year-old son, named Aaron. He's a very special young man. He has something in common with Dan Aykroyd, George Washington, Marilyn Monroe, and Robin Williams. They are all talented, creative, and famous. They are great additions to the history of the United States. They also have a condition called Asperger's syndrome. Just what is Asperger's syndrome? What are some of the symptoms of Asperger's syndrome? What is the best way to help your child live up to their full potential if they are diagnosed with Asperger's syndrome? Asperger's syndrome was first diagnosed by Hans Asperger in the 1940s. According to the Autism Society, he observed autistic-like behavior and difficulties in social and communication skills in boys who had normal, intelligent, and language development. Professor Jutta Frith with the Institute of Cognitive Neurosciences of University College London described individuals with Asperger's disorder as having a touch of autism. According to the National Institute of Neurological Disorders and Strokes, Asperger's syndrome is an autism spectrum disorder, one of a distinct group of complex neurodevelopment disorders characterized by social impairment, communication difficulties, and restrictive and repetitive and stereotyped patterns of behavior. The National Institute of Neurological Disorders and Strokes also states that as many as 1 in 88 children age 8 will have an autism spectrum disorder. National Institute of Neurological Diseases and Strokes also states that males are 4 times more likely than girls to have Asperger's syndrome. Psychologists, physicians, educators, and parents remain largely uneducated and uninformed regarding high-functioning autism and Asperger's syndrome. According to Michelle Faltig, an author for the Disabled World magazine, children with Asperger's syndrome may have speech marked with a lack of rhythm, an odd inflection, or a monotone pitch, according to the National Institute of Neurological Diseases and Strokes. Children with Asperger's syndrome are isolated because of their poor social skills and narrowed interests. They're awkward and poorly coordinated with a walk that can appear bouncy. According to kidshealth.org, Asperger's syndrome is characterized by poor social interaction, obsessions, odd speech patterns, and other peculiar mannerisms. An example of an obsession would be when you walk into my son's room, the walls are lined with Matchbox cars. He probably has accumulated well over 5,000 cars. He can also tell you where each car comes from and how much it is worth. Kids with Asperger's syndrome have few facial expressions and have difficulty reading the body language of others. In some cases, my son Aaron feels he needs to be unusually close to you when he is talking about one of his favorite subjects. They might engage in obsessive routines and display unusual sensitivity to sensory stimuli. Other characteristics may include motor delays, clumsiness, limited interest, and peculiar preoccupations. In some cases, aggressive behavior and or self-interest behavior may be present. It is important to understand that kids with Asperger's syndrome, unlike children with autism, show no delays in language development. They usually have good grammatical skills and an advanced vocabulary at an early age. Asperger's syndrome patterns and behaviors can vary widely from one child to another. There is not a typical prescribed treatment regimen. When my son was diagnosed with Asperger's syndrome, I became very alarmed because I had never heard of this term before. I spent many hours researching Asperger's syndrome and finding the best way to help my son adjust and succeed. I used the internet, the library, and the local autism society to educate myself. I found educational resources and training programs for myself. I, as a parent, must teach my child self-help skills in order for him to achieve his maximum independence. According to the National Institute of Neurological Diseases and Strokes, an effective treatment plan builds on the child's interest. A treatment plan may include social skills training, cognitive behavior therapy, medication, occupational or physical therapy, and speech-language therapy. An important fact to remember is that children with Asperger's syndrome can learn to overcome their disabilities. This condition would not prevent your child from succeeding academically and socially. Dr. Asperger, the doctor that defined Asperger's syndrome, stated that exceptional human beings must be given exceptional educational treatment, and which takes into their account their special difficulties. Further, we can show that despite abnormalities, human beings can fulfill their social role within the community, especially if they find understanding, love, and guidance. Thank you.